Good morning, everyone. My name is Fatima Zerriouh, and I'm going to present for you the prevalence of hepatitis B and C among patients with end-stage renal disease in Jordan, 2015. Patients with ESRD with end-stage renal disease are at increased risk of both hepatitis B and hepatitis C viruses, and acquiring such infections has a long-term impact on morbidity and mortality among patients with ESRD. In Jordan, the prevalence of hepatitis B infections in the total population has decreased from 9% in 1989 to 4% in 2014 in the total population. And the prevalence of hepatitis C infection is relatively low and estimated to be 0.42% in the total population in 2011. So our study aimed to determine the prevalence of hepatitis B and C infections in patients with ESRD in Jordan 2015. So retrospective review design was conducted from the National Registry of ESRD. All patients underwent dialysis in Jordan in 2015 from all sectors, including public, private sector, Royal Medical Services, and university teaching hospitals were included. We only excluded 6 dialysis centers out of the 75 dialysis centers who had incomplete data. Data were collected from in Jordan in the ESRD registry. Each dialysis center is required to report the hepatitis B and hepatitis C serology status every 3 months for all each dialysis patients. So we reviewed the National Registry of ESRD, which comprised all the 75 affiliated dialysis centers data till 2015, and we assess the prevalence of hepatitis B and C among hemodialysis patients. Data were analyzed using the SPSS software version 17 and Excel 2010. So 55 cases out of a total of 4690 ESRD patients were found to be positive for hepatitis B, and 378 cases out of 4690 cases, 90 ESRD cases were found to be HCV positive. So the overall prevalence of hepatitis C and hepatitis B and hepatitis C were 1.2% and 8.1% respectively. So to evaluate the geographic differences between the governorate or the dialysis center studied, each dialysis center is located allocated in a governorate based on the geographic location, and the prevalence of hepatitis B and C was distributed by governorate, as you can see. So the highest prevalence were found in Tafila and Aqaba, which are 2 governorates located in the southern region of the country. And the lowest prevalence was in Jarash governorates for both hepatitis B and hepatitis C. And we can observe that we can observe the high variability between the governorates for both hepatitis B and hepatitis C. So this is the age-specific prevalence for hepatitis B in green and hepatitis C in blue, and the most affected age group was for hepatitis B from 30 to 39 years, and for hepatitis C from 40 to 49 years. The sex ratio was 2 to 1 for hepatitis B and 1 to 1 for hepatitis C. And there is no significant differences between female and male for both hepatitis B and hepatitis C. So a study was done in Jordan in 2003 and reported prevalence of hepatitis B virus infection of 4%, and for hepatitis C 21%. And we can observe that there is a decrease of the prevalence of hepatitis B and hepatitis C, and different studies from different parts of the world showed higher prevalence for hepatitis B, such as Saudi Arabia and Palestine, who reported 4.6% and 3.8% respectively. And for hepatitis C, Egypt and Saudi Arabia reported 50% and 19% respectively for the prevalence of hepatitis C. Other studies showed a lower prevalence of hepatitis C, especially Iran and Lebanon, such as an example of 7.6% and 4.7% for hepatitis C. So in conclusion, the prevalence of hepatitis B and C viruses among ESRD patients in Jordan was found to be relatively low, but disaggregating this prevalence by governorate showed that the highest prevalence levels of hepatitis C and hepatitis B were found in the southern region of the country. And finally, this study demonstrated the reduce in the prevalence of hepatitis C and hepatitis C infection among ESRD patients during the last 2 decades. So this study has some limitation. The seroconversion rate is not evaluated. This study does not differentiate between ESRD patients who develop hepatitis B and hepatitis C before or after the hemodialysis. So it doesn't investigate the risk factor of developing hepatitis B and hepatitis C. And the other limitation is not including other variables such as co-infection and blood transfusion. So the prevalence of hepatitis B and hepatitis C were found to relatively low, suggesting that the infection control are working and therefore should be intensified. Some governorate are found to be higher in the prevalence of hepatitis B and C and need more investigations to investigate why this prevalence is so high. And the seroconversion rate has to be identified, and including other variables in order to better understand the risk factor to develop of developing hepatitis B and hepatitis C. So the Jordanian Ministry of Health and represented in the Non-Communicable Disease Directorate are acknowledged for their help and their support. And we also recognize the contribution, the editorial contribution of all the mentioned doctors who helped in this presentation. And thank you.
Dear Fatima, thank you for the nice presentation about the situation with hepatitis B and C prevalence among patients undergoing hemodialysis. Now, I would like to open the floor for any questions.
Okay, thank you for your presentation. Actually, I had a lot of things to be more clarified for me. For example, is there an explanation the geographical disparity among the cases, since we saw a lot of Tafila and Al-Aqaba, and in Jarash there's no case of hepatitis C and minimum case of hepatitis B. Is there any explanation for that?
Can you repeat your question, please?
Is there any explanation? أحكي بالعربي أريح?
No, you can speak English.
Is there an explanation for
The highest prevalence in Tafila and Aqaba?
Yes, between the governorate. There's a huge difference between the governorate and the prevalence of hepatitis B and C.
Okay.
And the second thing is about the prevalence. It is the opposite as it is in Jordan for the overall population, that you said the hepatitis B is more. Once we see here among the ESRD patient, hepatitis C is more prevalence than hepatitis B. Is there any vaccination policy in Jordan that these patients should be vaccinated, and because of that the prevalence of C is higher in these patients? And also I want about the age group distribution of the cases. Most of cases are within the age group of from 30 to 40, but after 40 there's a decline. It is due to there's less patient after 40 are in hemodialysis, or how the explanation? Thank you.
Okay. Thank you for your questions. So first, your first question is about the highest rate in the southern region of the country, let's say. And for now, it is unclear why this prevalence is so high in these two governorates and other governorates, if you have noticed. And the high variability between governorates, we didn't do the significant difference between, because there was a frequent shift of hemodialysis patient between dialysis center, so it was inapplicable. Your second question about the hepatitis B vaccine, yes, we do vaccine the hepatitis B. It's in the national program since 1995 with 3 doses, and we checked before the SRD patient is registered to the registry. We checked the hepatitis B serology status, and we give it 2 doses of hepatitis B. Your third question about the age distribution, why it is the age distribution, if we can. Yes, this is a valid point to raise. We will check about it and we'll answer your questions. Yes, I agree. This is like a baseline to start with, a descriptive study, and we'll do that after. Yeah, thank you.
Okay, fourth row. Yes, there.
You mentioned in your presentation that the prevalence of hepatitis C in Egypt, 50%. According to a demographic health survey published in 2015, the prevalence of hepatitis C in Egypt, 4.4, and in dialysis unit, prevalence of hepatitis C, 1.9. And this survey published 2015.
For
and
hepatitis C.
I want to know what is your source of this data?
The source reference is here. This is the only reference I found in the literatures. So maybe you have another publication that I missed. Maybe, yes.
Arabic and English language.
I will search for it. Yes. Okay.
Is 2015.
This publication is in 2000. I know it's very old, and this is the one I found. So
you will find something else. Okay? Okay?
I will. Okay, don't worry, I will.
Okay. I have a question. Okay, thank you. This is one of the comments that I was giving to you, that 50% in Egypt, you have to revise because I think it's
I will.
20 years older than we have in Egypt. And we have success in treating many patients in Egypt now. My question for you is about the testing. What tests do you use for hepatitis B and hepatitis C? Because, you know, in end-stage renal diseases, the antibodies are going to decline, and most of the tests, the rapid tests, are depending on antibodies. Thank you.
Okay, for the testing, we use for screening exam, use the ELISA for the hepatitis B, searching for HBs antigen, and for hepatitis C, searching for the anti-HCV antibody. If it is positive, we go further with the PCR. Yes.
This is the last question. No, I'm sorry. This is the last question. The second row. Sorry, but she asked me.
Okay, thank you very much for your very interesting presentation. And I have a question regarding distribution of hepatitis B and C. In introduction part, you give information distribution of hepatitis B and C in your population, as I remember, your population, and from where we can see the distribution of hepatitis B much higher than in hepatitis C. But at the end, but it represents previous years. And at the end, where you show results of your investigation among among patients who need hemodialysis, you have results that distribution among these patients, distribution of hepatitis C much higher than distribution hepatitis B. And now from these results, can we say that right now in your population, distribution of hepatitis C also high than distribution of hepatitis B in your population?
Do you mean that the distribution of hepatitis C among ESRD and compared to the
Population, yes,
general population?
Yes, because here in introduction part, I can see that distribution of hepatitis B much higher than C in population. This is population, yes, total population. But in the patients, we have different situation, different picture.
And the ESRD
distribution
patients.
of hepatitis C higher than B. And now, and it represents more, right, recently, your investigation was conducted. And it means that right now in population also change situation or no?
Okay, it can be explained by the mode of transmission of hepatitis C and hepatitis B. In the ESRD patient, the hepatitis C is the main mode of transmission is through blood. The hepatitis B is sexual, so it's mainly sexual transmission in the total population. So it is fair to have more prevalent hepatitis C through hemodialysis patient rather than low prevalence of hepatitis B.
Well, I'm very sorry, but the time is over. So we will have time to discuss further when we finish. I'm very sorry, but we have a lot of presentations. Thank you very much.
Thank you.